Imagine being in a room with women that you love and care about, your mom, your sister, your grandmother, your wife, your daughter. And look around that room, and if there are 6 women in that room, 3 of them will die of heart disease. 1 in 2 women die of heart disease.
There are statistics that show women don't have EKGs done as frequently, and blood tests aren't done as frequently as they are done in men that have the more common presentation of heart discomfort, of angina.
I had 3 blockages, one being a 90%, the other being a 70%, and the third was a 40%.
Heart attacks can be missed in women, and sometimes the occurrence of a heart attack in the past isn't found until a later point in time when another physician's looking at the EKG and says, oh my gosh, this has indication that a heart attack had occurred at some point in time.
Heart disease was a man's disease. And what we know now is that women die at the rate of 38% following a heart attack, and men only die of a heart attack 25% of the time.
I had no idea. I was healthy, I ate properly, I exercised, I did everything I was supposed to do. But at that point we found out it was the #1 killer for women, and here I was, a perfect example, not knowing, and totally no pains in my arm, no major anything. And I was this close to passing out because they told me that if I traveled and anything dislodged, I'd be dead and there's nothing they could do.
More than 500,000 women die each year in our country from heart disease. That's more than the next 7 causes of death combined, including cancer, breast cancer, and other types of diseases that women are aware of.
Now that there are so many ways of preventing so many of these horrors that come into our lives, we have to take advantage of it. Now that they have this heart screening program, I think it's the answer to everything I was dreaming and thinking of that could have saved me a lot of aggravation and surgery had I known on an early stage that this was brewing, but I had no way of knowing.
Part of the objective of this women's heart program, I think, is not only screening, but hopefully education and awareness. And I think to bring this to the forefront in the minds not only of women themselves, but in physicians that are caring for them, to truly understand that cardiovascular diseases really are the most common cause of death and disability in women in the United States. And there are important differences between women and men in the way it presents itself. And because of the difference in presentation, it kind of makes it more difficult to properly diagnose the situation.
The awareness is not out there. Women tend to think, well, it's not going to affect me, I don't need to worry about it. So that's all the more reason to have a screening program to heighten the awareness so people start thinking about the risk factors, their cholesterol, their exercise, diet, family history, high blood pressure, diabetes, all the things that they need to take care of that maybe it's not put into a package for them to say, hey, you have this many risk factors and your risk for having a heart attack or heart disease is this percentage. Is going to raise it to a level of awareness where people want to make a change.
I think if women understood how quickly it happens when they have no knowledge at all, they would do something to be preventive of it, because you don't want to have what I had.
The screenings will only take 45 minutes and will only cost $40. So we want to make this accessible and affordable to all the women in our community. And we hope to think that even though it's a women's screening program, the Take Heart program is open to men as well. We hope that women will bring their husbands and fathers and sons with them to both be aware of their risk factors and then take those steps together to improve their quality of life and their length of life.
Take heart, get all the friends and relatives you have, and get involved. This is the time. This is when it counts. Take heart. This is the time to start.